Welcome to the Period Besties Podcast with Stasha and Katie. Think about it as chatting with your best friends about all the TMI stuff you've never talked about before with two period coaches who've been helping hormones collectively for over 20 years now. I'm Stasha.
And I'm Katie, and we're pulling back the curtain on what it's like in the world of menstrual coaching. From puberty to menopause and everything in between, we're here to show you how period coaching can save the day. We'll share practical tips and information you can put to immediate use to improve your hormones and happiness.
We're removing the mystery, ending the taboo, and shining a light on just how powerful period coaching can be.
So whether you need period coaching or are considering becoming a period coach yourself, these episodes are going to help you. We'll share stories, coach live on air, and bring smart, savvy guests to share their wisdom too. Let's start today's episode.
What a fascinating conversation we had today with Sara from Upper Health, all about really natural medicine and how she is really, oh my God, like just changing systems that have been in place for so long when it comes to healthcare. Oh God, I just learned so much. I've known Sara for a while, so I knew some of it, but I also learned a lot today during our conversation.
Yeah, I was super fascinated about her workaround for the health insurance, her workaround for dealing with doctors and all that kind of stuff. And then, of course, the natural approach where it's let's try these things before we dive into the form of pharmaceuticals or that kind of thing. And I know you and I have talked about this on the podcast with so many people about you're aging, things are coming up. What can we do to prevent going on these medications earlier and younger, those kinds of things. So to have a health system that's preventative focused to help you get off of prescription medications that you may not actually need if you had some lifestyle rearrangements, some dietary rearrangements, those kinds of things, to be able to make you a healthier person, less reliant on doctors and prescriptions and those kinds of things. And then knowing, okay, we're at the end of the line, we do need to now dive into a pharmaceutical intervention of some sort. But I know I do this, my family does this, our listeners do this. Most of us want the healthier, natural option first. We want to exhaust our ways before we dive into, now we have to take this prescription and then we have to take that one to deal with the side effects of the first one. And then we need to take this third one to deal with the side effects of the second one, and that whole ongoing spiral. So I love the idea, and I don't know why our medical industry doesn't go prevention first. Yes, I do. It's money. But I love the idea of having a health system that is nationwide that can deal with all of those money, insurance issues to make it so that you can go that healthy route first. And then you feel confident saying, I tried everything before you jump into the next step, right? Or take the surgery or do the thing. So you can feel like, yes, I did try everything before making this last drastic move.
Yes. So for all of our listeners who've been following along with us for a while, and we've been talking about what can you do, who can you go to, how do you get more natural preventative support, listen in, learn all about Upper Health, and I think you're going to be really impressed with what she's built. Enjoy. Welcome back, Period Besties. We are so honored and excited today to have Sara from Upper Health here to talk all about preventative healthcare, and she is really shaking up the system, and we're so excited to have you here and sharing your vision and what you've created with all of us. So thank you so much for being here.
Thank you guys for having me. This is awesome.
Yes. So we always like to start off just by having you share who you are, what you've created, all of those things that have come into play before you started Upper, actually, and why.
Okay. Yeah. So before I started Upper, so my name is Sara. I've been doing the natural healthcare, natural medicine thing for probably close to 8 years now, 8 or 9 years. And so I started my career as a personal trainer. Did that for about 2 years when I first moved to Wilmington, North Carolina. While I was training folks, I thought I would have your typical athletes and your weight loss clients, and that is just not at all what happened. And so I got my first real taste of helping people who were actually pretty sick get a natural form of treatment for their conditions. And so my entire client load for almost 2 years became people with multiple sclerosis, amputees, people with tremors, brain implants. I had people with short life expectancies. I was getting referrals from the hospital, neurosurgeons doing rehabilitation, teaching people how to walk. I could go on and on. It was just a huge learning curve for me. And so while I was training, I would meet folks who couldn't afford training, of course. And it's a very expensive service, especially back then. You're talking almost a decade ago. People with disposable income, right, are typically the ones buying personal training. And of course, insurance didn't cover it. I don't know still for the most part if they would cover it. Probably has to be prescribed, of course. And even then, I don't know if they're willing to cover it yet or not. I haven't seen it yet, but it's possible. But so my first company I opened in 2017, and that was a nonprofit, and it was charity care for natural treatments. So if people had some kind of condition and they qualified for financial aid, we were raising money at this nonprofit to help them afford natural treatments, which started with fitness. Slowly expanded into all the different modalities of care. And then to summarize, in 2021, we opened those doors up to the public because we had so many people calling us who they weren't interested in the financial aid as much as they just didn't know where to go, and they wanted to avoid pharmaceutical drugs and surgery. The whole thing was just the snowball effect in my career. And so now here we are, we have what we call the nature first health and medical system. And the goal is to build a national hospital system out of that company. And that is open to the public. People could come purchase services from the company and get care directly with us.
That's an incredible journey. So, if I'm understanding correctly, you've basically created a nonprofit and for-profit, like two branches.
So the nonprofit still exists, yes. So the health system is really, we call it a conglomerate. It's a conglomerate health system. It actually has 3 entities. So the nonprofit became its foundation. So nonprofit is still charity care. It's still financial aid when folks can't afford the care. They do have to qualify with their income and other documentation. And then the for-profit is Upper Health. That is, the large health system of just hundreds of specialty providers in the natural space. And then we also just opened our 3rd entity in the system, and that is Upper Medicine. And Upper Medicine, we just put at the forefront, and that's a clinical staff that takes the patients in directly, does their initial assessments, and are the ones ordering and prescribing all that specialty care throughout the rest of the health system. So all 3 entities work together as one company.
So you quite literally are able to put somebody exactly where they need to go that was best for them, for their finances, for their health.
Everything. We're building a whole medical system that is nature first in design, in the flow.
I'm in love.
Thank you. I appreciate that.
No, I like it. It's similar to something I started off with a for-profit business, coaching, health coaching. I did athletics as well. So I was coaching athletes and then moved into menstrual health. And I'm working on the nonprofit side now. So I'm like super fascinated personally as well, because I'm like, okay, we're branching out. How are you doing? Because now I'm asking everyone, how are you doing it? How are you doing all these things? So I'm working on my own version of that for menstrual health. So I love it. I think that's fascinating.
Yeah, they really complement each other. We call Upper Born Good. Our investors were telling us you really should advertise that. And they're right. And it's a great point because it's certainly where we're from, right? It was very organic, but we were born good. We had so many providers join us and start providing care at little to no cost, often just volunteering and raising money, right, to pay for it. And so truly at the roots of Upper, everyone inside of it started as a completely selfless culture. So we knew from day one that we had started with the greatest people you could find, right? Because now that we've only expanded into the for-profit sector, I shouldn't say no one cares about the money. We don't, right? Like we're not doing this for the money, but everyone's there for the right reason. And they always were. And so that will never change. So it's been an awesome way to grow.
Oh, that's fantastic.
That's incredible. Yeah. I am so curious about your personal journey with really focusing on preventative care. Was there something in your personal life, or obviously even just training people, that needed that extra attention and care? Because what it sounds like is PT, but training, personal training. Yeah. Like it's really interesting, like how you were working with these individuals that might have just gone to PT, but not necessarily been trained long term. There's a little bit of a difference there. So I'm so curious.
Yeah, I think the world really misunderstands personal training, and I didn't know that until I was doing it. I'll tell you my personal background, and not ironically, I grew up in upstate rural New York. My family's very country. It was all hayfields. My family owned 21 acres of hayfields, but surrounded by thousands. I probably had 5 neighbors and God knows how many mile radius. And so we had a local trade with our local village farms. We would actually feed their cattle, and then we would get a meat trade and things like that for food. My mom home grew so many vegetables and fruits that we ate every single day. And so I grew up very natural and very outdoors, very barefoot, very raw. And so whenever something came up when we did need to go to the doctor, we weren't allowed to take prescriptions. It was just not something that we did. I'll never forget those arguments too in my family when my mom would think that maybe I needed something, my dad would be completely against it. And then at the end of the day, it was like, you know what, we're a natural family, we're not doing this. And so I grew up not taking pharmaceutical drugs, and that was a very firm thing that we don't alter who we are, essentially. We don't suppress who we are. We understand why something's happening, and we put in the work to change our bodies and learn as best we can with that. Now, of course, God bless, we were so fortunate that we didn't have any kind of fatal conditions that we needed these things, right? But just when things came up at school, you got a little cold, whatever it was, we were not band-aiding those kinds of issues. But so growing up and that being my background and already who I was, I played sports my whole life. I played soccer in college, which is why I became a personal trainer when I graduated. And training, like I said, very misunderstood field. A lot of trainers go on to become physical therapists. I think that maybe a lot of people don't know that, but you wouldn't even know that as the professional till you're in it and you're like, I'm teaching people how to walk. How did they find us? But you wouldn't believe how many people are in that fitness center because they have something going on already. Like they joined the gym because they're like, wow, I got a diagnosis. I'm missing a leg all of a sudden. I have this. If you really look around a gym and you really pay attention to people physically, there's some ripped folks at my gym here. There's a guy without an arm. You'll see some amazing people at the gym, and they joined because they needed they wanted that optimization. Their life's already hard.
Yeah.
And so God bless them for getting in there and doing that. When they sign up for training, the trainer's in for a serious education.
It makes sense. If you're actually really paying attention, I feel like so many people go in there laser focused. This is my workout. This is what I'm going to do without necessarily noticing maybe everybody else that is putting in the work.
Yeah. And if you keep your headphones on and don't talk to them, you won't hear it either. So
Yeah.
a lot of them don't have visible illness. Maybe they're not missing a limb. But if you take your headphones off and start asking questions, there's probably 20 people around you who got some bad news that year, and they're in there trying to fix it themselves.
Yeah.
Which is cool.
When Katie was telling me about your business being preventative forward, it made me think of back in the day, there used to be the traveling doctor who came by the village. And I remember reading someone say, they would be paid if you were healthy, but you didn't have to pay them if you were sick.
Interesting.
Right. So the doctors would come by and their job was literally to keep you healthy because they didn't get paid if you were sick. Then they had to do their job and get you better. And then when you were better, you could pay. So I thought it was an interesting flip. And then when she was telling me about that, I thought, oh my gosh, this just reminded me of this old, I don't know how widespread it was, but in some area anyway.
And to give you some perspective, if you guys want to get really down the rabbit hole.
Do it. Okay. Dive in.
All right. You want me to dive? Okay. All right. We'll dive.
At first.
So personally, I have a strong belief, a very strong conviction that we're in an age and we're in an era and we're in a mindset of society where it is very difficult to sell prevention. So one of the major problems in our country is that you've got all these people who actively participate in wellness and preventive care. Probably us right here on this call, the 3 of us. We're out there, we're taking care of ourselves, we're buying healthy food, we're trying to avoid sickness every day. Yeah. That is a great population as it is. And they buy those things all day long. Then you have what might be the 20% of the population who's already so sick and not doing that. And they eat 80% of America's healthcare costs, right? Like they're driving down the medical economy because they're so expensive in their conditions. Unfortunately, we're in this state now where those people have already been made to be sick by what's gone wrong, right? Earlier on, decades ago in the system. And so now they've got the compound effect of illness and their lifestyle is difficult. These people are not buying prevention. And the other issue is you have all these wellness companies opening who open to change America, right? They want to change healthcare. But from what I've seen so far, and as someone in the business to do this, those companies typically just do what I call absorb the existing market share. So they come out with wellness products or they sell prevention to people who are already buying it. But the real problem here is that you've got all these people on prescription drugs who depend on their health insurance, who don't have the disposable income potentially, and who are not going out of their way to buy wellness. And they are the ones we need to target and change in order to change medicine in America, right? And to fix everything that's going on from a consumer standpoint, consumer health standpoint. So while Upper focuses on getting people to that preventive state, it actually starts with natural medicine for conditions that already exist or you have an urgent medical need that day. So our mission statement is saving lives by design. And so what that means is when someone has a medical need, we first target that. We say, okay, you're sick today, right? You're already on a prescription. You're sick today. You have a condition, or maybe you don't even have a prescription yet. Maybe you just found out that you don't feel well. You come to Upper, and how we save lives by design is by first prescribing not a pharmaceutical drug, right? We're still tackling someone who's already sick. And so we start with sickness, unfortunately. However, you're not going to have side effects from your treatment. You're not going to go down this compound effect of needing other drugs or getting other illnesses. You're actually going to have a compound effect into improving your life through natural remedies. We're going to tackle this urgent need first. And then over time, you're walking backwards with that person into their lifestyle every day until you get so far back. Last step, and then I'll shut up. You get into, I know it's long-winded, you get into what we call environmental design. And so you redesign that patient's physical home, their land, the products in their house, and you change their traffic pattern so that prevention, I call this automated prevention. So if these patients, if these consumers are not going to purchase wellness products, like they're not buying it. That's not what triggers them. That's not what motivates them to change. If they're sick, they're going to the doctor and getting the wrong prescriptions. We catch them right there, walk backwards into their life, and we get to the point that prevention is the focus, but it becomes totally mindless. They don't even have to think about the decisions they're making because their environment is redesigned to be conducive to better behavior.
Genius.
So we automate prevention like that probably a year plus into the patient's life with us.
Makes so much sense to meet them where they're at and walk backwards.
You have to. The system's already so broken. Everybody's already sick.
Yeah.
How do you undo, right? How do you cut waste, essentially? How do you cut drug waste in humans? How do you cut bad prescription behavior? How do you cut the behaviors of someone who doesn't want to go out of their way to change?
Yeah.
And that is the problem.
That's fascinating. Yeah, it's like being a coach, right? You have to meet people where they are and go, okay, and it's interesting that you say that it takes a year plus, because I'm always telling people, if you really want to work on menstrual health, I need more than 1 month. That's only one period. That's only one ovulation. I need several ovulations, several periods. I need to see the patterns of what's going on. You can't do this in a month or 2 months. We need time to really see how things happen, how they affect you, that kind of thing. And you have to reframe things for people going, oh, it's not a year, it's 12 periods. So that makes so much sense to me to say, if we're going to take somebody who's in this 20% extreme, we need time to walk backwards, figure out a way that works for them, to integrate it into a way that they can continue it without it being really hard without it being willpower focused. That's always a really
Really.
hard one.
Willpower's a myth.
Yeah, absolutely.
Total myth. Your environment is structured to help you make better decisions.
Yeah.
Decisions are either easy or it's hard. If you live in a room full of Doritos, it's probably hard not to eat one. Something basic and stupid like that, it's true. It's true for everybody.
Yeah.
If you're just already healthier, you probably have somewhat better of an environment to make those decisions.
Yeah. This is why we don't keep sugar in the house, because if there's sugar in the house, I will eat the sugar.
Same. 100%. Yeah.
Yeah.
I am so curious about working with people's mindsets, right? When they're in that 20%, like they're already sick, and
Sick.
working with them and going backwards. Because with my clients, like we talk majority of the time on mindset and really changing those patterns and those thoughts. So when you're meeting with these people where they're at and they've already been given the only option as pharmaceuticals, how do you work with kind of their mindset and really helping them shift backwards?
I can tell you where it is easy on us is that someone who's already sick, and I don't care who it is, they're tired of being sick. So it might not be that they're willing to go for a run every day. They're not going to make some big drastic change overnight. But when you start with, let's say you've got someone already on a prescription, simply coaching them through helping get off that prescription, right? Describing them from their drugs, that alone is a huge motivator for them. And that might take very small steps. And not for nothing, I say it could be a year plus before you're getting into the environmental redesign of someone's physical house. Like you're walking in and you're like, hey, you get up to pee first every single morning because your bathroom's attached to your bedroom, right? That's just explaining traffic pattern to them. That's why you do that. If the coffee was in the bedroom, you might make the coffee first, right? Like stuff like that. But if someone really struggles that much with putting in physical effort to change, like, hey, you do need to go outside and go for a walk every day, you might have to start with the environmental redesign. It doesn't necessarily always have to be walking backwards. It really depends on, does this person want to start exercising, whether the gym's close to the house or not, or whether they have a walking path outside their house or not, they have to drive to it. You do have to be able to measure that stuff on your patient as soon as you talk to them. How motivated is this person versus how effortless does this need to be right away if we're going to get anywhere?
Yeah.
Yeah, makes sense. I feel like those are so many conversations that we both have with our clients too. Maybe it's just putting the sneakers next to the bed. So when you wake up in the morning, you see your sneakers and you're like, trigger, okay, your mind's, yep, I'm going to go for a walk.
That's environmental redesign right there. Yep. That's exactly what you have to figure out is how hard is this for this person to do on their own? How mindless does it need to be right away? Yeah. All that stuff matters.
Yeah, that makes so much sense. Just clients, I have endometriosis, so I've had a number of clients with endometriosis, and they're always like, I'm willing to do anything. Let's do it. But then you have clients that are like, oh, yeah, let's just one step at a time this. I'm always like, are you a rip the Band-Aid off? Are you in an extreme? Or are you a one step at a time, integrate this in a sustainable way? Obviously, I'm a rip the Band-Aid off person.
I'm a rip the Band-Aid off person.
I am too.
Yeah. Yes, rip it.
Have you had any pushback on this?
From who? Patients?
Doctors, pharmaceutical companies?
Oh, yeah.
Sure, literally anyone.
Oh, yeah. You don't want to know about all that. I was driving the other day. No, I won't even get into that story. I definitely protect myself all the time.
I don't doubt it. Katie and I talk about this, and some of our guests have talked about this just because we talk about menstrual health on the internet, where we get all kinds of comments or DMs or things from people and how it's changed over the years, but how sometimes we still get the I don't need you to tell me how to have a period or whatever kind of comments where just people showing the ignorance. But or dudes that are like, that's disgusting, that's gross, you shouldn't be talking about this in public, that kind of thing. So we always find the pushback to be a little bit of not collaboration, just like having other people and going, yeah, no, we've experienced it as well. We're sisters in arms out there.
Yeah, and I think you're always going to have people who just don't share the same opinion as you, who just don't believe in what you believe in. So we certainly get doctors who want nothing to do with me and think I'm crazy. But then we also have doctors who are like, God, where have you been for so long? And those are the ones you have to listen to. And then we also get besides the general opposition, I've had people be so rude to me in the middle of conference meetings. I've gotten in back and forths with people. I've gotten in arguments with folks in meetings. I've had meetings end and the rest of the team or the executives of that team call me and apologize on behalf of the ones who made super rude comments, which always cracks me up. I've gotten threats. I've had phone call threats. I've had really interesting things happen. I've had people call me on recorded lines. Really weird stuff. Very strange things, but it's inevitable if you're doing something that matters.
Yeah, you're disrupting healthcare.
Yeah.
So people are going to be not happy. Some people are not happy about that.
You just pay attention to the ones who care and you just protect yourself. That's all.
Yeah, no, definitely. That's like Dr. Amen. He was on a podcast recently talking about different things and how he has to protect himself because he's disrupting brain health. Yeah, I thought that was interesting because I think he's in his 80s. I was like, oh my goodness, protect him.
Yeah. Yeah.
Yeah, it's hard. It's a tough system because it is certainly something, obviously, I just don't understand how anyone can argue that the US healthcare system doesn't need reform at the very least.
One of the sickest countries in the world.
Yeah.
I don't know how long you can keep the blinders on for. You choose to lie to yourself.
Yeah, we're a very sick country and we spend like as much as all of the industrial countries combined or something insane on our healthcare, all to not really have any problems solved. It's just a tough situation. And to think we don't want to improve it, we don't want to change it, we don't want to at least try something to make it better is mind-boggling to me.
I read something the other day. It was cracking me up. It was I think it was just a meme, but it said, "Congratulations to Pfizer for being in business 175 years and never curing a single disease."
I've seen that too.
What a wake up call. How can that whole industry own the word cure and keep people like us from even using it and say that everything that we do is over here or woo-woo or whatever they want to call it, and not in their own lifetime have they ever cured one condition, nor will they. They don't want to.
Yeah. There's no money.
Yeah, and
as long as
that's the problem.
Yeah. Healthcare.
It's all about money. Yeah.
I give you so many rabbit holes. If you want them, just let me know what you want.
Just give us a whole bunch of links. We'll put them in the show notes.
Noted.
With everything that you've done already, I know you have a vision. Where do you see Upper going next? You have these 3 branches already. Like, where do you see this going?
So one of the major barriers, I'll say 2 major barriers. One is that because we are in it to change the medical system for the country, and I mean for people who are sick, not absorb the existing market like ourselves, not interested in reselling something to folks like us. It's here for you. We're over here, and our focus is the insurance model. So getting people to either understand the benefits of paying out of pocket for their care first, even if it can be reimbursed, or having people prioritize funds for something like that, or even coming out with a product someday that competes with insurance. Like, getting through that payment barrier is the biggest problem in our industry. And so for Upper and any competitors alike it, we all actually face that same challenge. And that is, I've used the term Holy Grail a couple times in some different things in medicine that we do, but that is one of the holy grails. If that gets solved, you will become the biggest company in the world, direct to consumer, multi-billion-dollar company. That is what blocks people from enrolling. Almost that alone, almost. The other most important thing that needs to be solved is convenience. So we've got over 85 different natural brands in our network, 200 plus locations nationally within those brands. And so that includes fitness centers and dietitians and primary care offices and every type of provider that we would allow at Upper, a nature first approach to care. And so becoming more and more integrated with those physical facilities, we are actually providing care on site in fitness centers now. So when somebody needs an initial visit, we call ourselves natural primary care. We do that for legal reasons, and it is. There's nothing a primary care office can do that we can't do, but we have to call it natural primary. So we can do our visits for that branch in O2 Fitness, Anytime Fitness, the YMCA, a handful of fitness centers we have a network. We've already been doing that with them. And so where I see us going, where it's headed, we have got to find a very large, scalable, and something that is easily duplicated a way to make Upper a physical hospital system in other brands, right? Where you know that you went to this dietitian's office or this fitness center or this doctor's office, but they were all Upper's health system and they all work together and they all communicate and they all co-treat patients together. It's a difficult thing to solve, but making it the most convenient care in the world is the other way the most people are going to use it, right? McDonald's and Starbucks are strategic and they're on every corner. You've got to make it accessible. And so those two things, payment and then convenience, that is the market. That is what needs to be solved. And that's pretty much what we focus on somewhere in our day, every single day.
So simple, but so true. So when we're talking somebody trying to find you, where do they go? Can they go someplace or do they go online first? Or even back up, hold on. Who is this for? Describe the people coming in so that anyone listening can go, okay, this is me. I need to go find the link.
If you have anything medical going on whatsoever, and you are avoiding pharmaceutical drugs or surgery or any unnatural interventions, that is who we are for. Whether you're just trying to figure out how not to take a Tylenol that day, or you've already got a diagnosis, or you're trying to get off your prescriptions, Upper would be your first stop. You'll find us by going on our website, which is upper.health, and just hitting that enrollment button.
That's everyone I know at some point is, okay, you need to get on the cholesterol meds. You need to get on the statins. You need to get on the something or others, right? Like I watched my own parents go, no, we're going to change some things. We'll do some different things, and avoided it for, 20 years or something, and still going by making diet and lifestyle changes, having to fight that fight for a long time. So I know it's inevitable for all of us, right? Especially you hit perimenopause and those numbers start to climb and your doctor's first reaction is to go, let's get you on a statin. And it's, hold on, let me try. But then you're like, okay, but hold on, let me try and do something. What is something?
Yeah.
So this is where I think a lot of our listeners are probably in that space where they're being told it's time to get on some of these more age-related medications and going, why does that? But I don't want to start on that. That seems too young. Or is there something else I can do?
And the quality of life too. Like, what's the quality of life if you are going to the doctors every day? I watch my parents, they're in their mid-70s. Like, the doctors always want to see them.
Guinea pigs.
Yeah.
Yeah.
And my mom has high cholesterol and she works so hard every day with her diet and lifestyle and has never had to take statins. Thank God.
They'll put you on cholesterol meds and try to get your cholesterol way down. And they won't tell you that causes Alzheimer's disease. Your brain needs cholesterol in order to not get Alzheimer's. You can't do any of that without creating collateral damage, right?
100%.
It's just not.
And it's like, what's your quality of life? Like, you might be living longer, but you might, like, what are you capable of doing every day at the same time?
We are, we're working on coming out with a few different things. You asked about where we're headed, and to both of these notes, I think some of the biggest things, besides overcoming the payment barrier and the accessibility barrier, as a company, I think what will really show people the value is being able to someday prove whether or not somebody needs pharmaceutical drugs. So that would be huge, to be able to prove whether or not you need your prescriptions. And then also, we're coming out with this hopefully soon. We can technically do it now, it's just not as fast as we want it to be. But just opening up a complimentary triage line that the public can call in. And if you get prescribed something, you can just call a phone number and find out what the alternatives are for free. And it cannot be construed as medical advice, especially if you're not already enrolled as a patient. There's no medical history behind it. It's just, hey, I got prescribed this drug and I'm just curious what the alternatives are or how to avoid this or what would be even remotely interchangeable. So having something like that available
would be so helpful. Just to even get more information about what the drug side effects are and like how, because I know they give you that pamphlet of 20 pages long sometimes of like information, but it's so helpful to talk to somebody a human and really understand how your body's metabolizing it and how you're going to react and all that stuff.
Yeah, we'll open that up soon. That'll be we already have a triage phone number, triage phone line, but that'll just be a complimentary service we open up to the public where if you just want to know what the alternative is to something, you just call that day and get the information and you can hang up. That's it.
Like a
Uh,
non-AI Google.
Yeah, we call it our natural first response line. So it's like a virtual first responder for anything natural.
Rather than AI.
Real humans.
Yeah, because like when you Google
person.
something now, AI is the first thing that pops up, right? The AI response.
Yep.
Which you have no idea if that's helpful or not. So then you have to actually go dig into it.
Have you ever asked it to do math and calculate you things and create calculators?
No.
No.
It's super inaccurate.
You would think math would be the one thing it was good at.
Yeah.
It can't even, there's times I'll have it build calculators for me and it can't even check its own math or check. It's wrong often. You've got to be really careful.
Yeah, I don't really use it very much. So I'm a bit of a novice because I don't want to steal artwork. So I don't use it for anything art related because I have just too many. I'm an artist. I'm a writer. My partner is a photographer and painter. There's just too much art in our world. So we don't use it for art. And then I'm already not good at math. I don't need math I can't trust. So
Yeah, I use it for concepts and theories and just innovative ideas. I ask it questions to help me think through ideas. And that is helpful. But then I'm like, oh, tell me this calculator.
yeah. I'll ask it to slim stuff down. I'll be like, here, I'm very wordy. I'm a writer. Make this a newsletter copy. Make this 3 dot points. I'm with you on that. I think that's such a great idea, though. It would be like someplace you can go for reliable information. And then you can find it. Yeah, that's such a big change to our system where everything is go Google it, see, and then you have to go then down several rabbit holes to know whether or not that's true, side effects, repercussions, collateral damage, all that kind of stuff.
It's really overwhelming to think about. I was telling my husband the other day, because we're a company inventing the natural first order to everything, right? Like it shows you how much needs reinvention and how much reinvention there really is to build, how many problems there are. Because when we came out and said, hey, we're going to be a natural first health system and a big health system, like whoever your health system is, where you are physically located, I'm talking big hospitals with lots of remote clinics, that will be upper. It's just all the independent practices that unified. That's the only difference. And it's one brand helping them unify and share system policies and protocols and whatnot. Anyway, it's so overwhelming to think you come out with this hospital-like brand and you say, we're going to be natural first. Well, that's every department. Natural first response. What does that mean? Natural first urgent care. What does that mean? Natural first primary care. And then you get into the weeds of the different services. Like you can go down every little rabbit hole and it gets very overwhelming for how do you help people achieve things in a traditional medical system, but just in a way that doesn't compound them into sickness. Whatever department you're talking about. What kind of diagnostics can you come out with? What is a natural first diagnostic? There are so many things that are now game for reinvention. It would be life-changing to the system. It is a whole new healthcare system that doesn't base anything on the current. Nothing.
Yeah. And giving people more options too.
Right.
Yeah.
Yes.
So my question to you is, you're basically creating a whole new healthcare system, right?
Yeah. Natural
How are
first.
you taking care of your health? What are your non-negotiables? What are your priorities when it comes to you?
So I am religiously outside as often as possible throughout the day. Even if I have to work outside, I sit on my deck, I open all my doors, all my windows. I take my dog for 3 long walks every day. I do get to the gym probably anywhere between 5 and 7 days a week. Even if I've only got 20 or 30 minutes, I still get there. I eat super clean, but I grew up eating like that. I've never wanted a bag of chips. I still don't. Thank God. That's just not me. I think the worst thing I probably do is drink coffee, lattes. But other than that, I pretty much eat whole foods. I crave that stuff. Obsessed with being outside because I grew up that way. And I love sweating and exercising. I love my dog, right? The animals. I'm just so blessed I was raised that way. So I really haven't had to put a lot of effort into that now. And it's a time commitment, but I would tell you I'm a more effective and a much more efficient professional for being well. I would do worse at work if I wasn't well. And have you heard of, there's this new thing out, and I don't know what it's called or where to find it or how to do it, but apparently you can now invest in the 50 fittest CEOs companies as like a portfolio option.
Oh,
And so those 50 companies, those 50 fittest CEOs apparently outperform every other company in the market. Isn't that interesting?
I'm gonna look into that.
That's an investment strategy now. But it goes to show that when you take care of yourself, your company, and again, I don't know the statistics and the data about, I've just heard about this in the last few months. I need to look into it and really read the details of how they're performing and what's performing better specifically. But yeah, apparently those are the most effective, efficient companies in the market. And that is the investment strategy: is the fitter you are, the better you perform. When the fitness level of the CEO drops, the company performance drops.
I work with my companies all the time with corporate wellness, and my whole thing is I need to talk to the CEO. I need to talk to the C-level people, because when they take care of their health and then it trickles down and the employees feel okay leaving at lunch to go work out, getting lunch, like that is where I always am. And I do a lot of like management training with that. I'm like, all the directors, everybody who manages anybody needs to be up there and learning how to take care of themselves, because it's so true. Company might want to do it to say that they're doing it, but in order to create real change, it has to come from the top.
Always.
Yeah.
But yeah, I heard about that and I was like, if that's not motivation as a business owner, I don't know what is. Like, you can't even deny that it's effective. You want to be the best? You better take care of yourself first.
Yeah. We all know firsthand, like we own businesses. We cannot show up for anybody else if we're not showing up for ourselves first and taking care of our health first.
That includes in your relationships, in your marriages, and your children's lives, and all of it. It's you, then family, then work, and that will ruffle a lot of feathers. But it has boded very well for me in my personal life, my husband, our friends who have followed that, other executives I know who follow that. The opposite never seems to go well for long term.
And we have to think about fulfillment too, right? Taking care of yourself should be your top priority so that you feel fulfilled doing all the other things.
Well, and you can give your best self to all those other things.
Yeah.
Right? If you don't like yourself, how could you possibly go do well in other areas or give your spouse your best self if you don't like yourself? If you feel a certain way about yourself, you can't.
Yeah. You can really tell when you speak to people and how they take care of themselves. I always love watching you on your bike. You have a little electric bike zipping around town.
I love that thing. I still ride that. People are like, I can't believe you're 8 months pregnant, 9 months pregnant, still riding that e-bike. I was like, I can't believe you think I'd stop. He loves it. He's going to be riding right next to me when he comes out.
Yeah. I know. I see you sometimes riding around. I'm like, there's Sara.
Yeah. Oh my gosh, that's too funny. Yeah. Fearless.
Amazing. We have a lightning round of questions to ask you, but before we dive in, where can people find you, or socials, anything that you want to share for our people, and then tell them about your free gift?
Yes, so definitely follow Upper. I encourage everyone to go to Upper's social medias. Instagram is just upper.health. I believe any of our other social medias, if it's not upper.health, it's just Upper Health. And then the other question was the free gift. So happy to give away a 6-month membership to Upper. Our membership is a discount membership. So you essentially would normally buy the membership to get specialty pricing on all of your care with us, from the clinical visits to your diagnostics, any products you need, whether that's vitamins, supplements, prescriptions, God forbid, and then all of your specialty care. So that's a 6-month free membership for lesser cost care.
Well, we'll definitely be looking into it. My partner just started a new job and is now Sans Healthcare. So
Okay.
I'll certainly be passing on the information, and I'll be right behind him, I think.
Definitely. More than welcome.
I love it. All right. So these are the go with your gut, your intuition answers. We're just gonna rattle through them, but this is a great way for the listeners to get to know a little bit more about you as a human being, which is the idea, right? So, what's your number one self-care go-to when you're just super stressed out?
Go for a walk. I would say run, but I haven't been able to this pregnant. It's a little painful. A little much for the pelvic floor, but definitely go outside. Yeah.
What's your favorite book?
Atomic Habits by James Clear. That book is essentially like a blueprint of Upper, which is wild because I didn't read it until way after the company opened.
That's amazing.
It's a good book.
What's one thing you can't live without?
Can I say my husband?
Yeah.
Totally my husband.
Oh, that's really sweet.
He is the best.
What's your favorite snack?
I don't snack. Favorite snack? If I had to snack on something, I love fruit. Fresh fruit. Blueberries, strawberries, you name it.
What's your guilty pleasure?
Guilty pleasure. That's so hard. Oh God. Something I'm not supposed to do, but I enjoy doing.
Doesn't have to be like that you're not supposed to do. It could just be like somebody once said, not on our podcast, but one time somebody said, I just go in and delete all my emails after vacation. And I figure if they come back and email me again, that's fine. But I just delete all when I come back from vacation.
That's hilarious.
Yeah. Guilty pleasure is a very loosely defined question there.
Yeah. Oh boy. I would say if I'm gonna eat an ice cream or something, I'll do that in the middle of the day because I don't like eating dessert late at night. So I'll eat ice cream at lunchtime or something. But I don't ever do that. I don't have a great answer. That's hard.
It's me, romance novels.
I'm a huge nerd. I write essays for fun. I don't know if that's an answer, but
I remember you told me that. I love it.
yeah.
Where would you live if you could move anywhere and price doesn't matter?
I would stay right here in Wilmington, North Carolina. You couldn't buy me out of this city. This is the greatest place I've ever seen, been, lived, experienced in my life.
God, I love it here too.
Yep.
What's your favorite season?
Ooh, that depends where I am. I would say here in Wilmington, the springtime. If I'm back home in upstate New York, either the fall or the spring.
Yeah, fall in upstate New York is pretty spectacular.
Some awesome time up there.
Do you have a most loved or most hated food?
Oh, I'm starting a real, gosh, I do have a favorite food. It is sushi. I love sushi. Raw tuna is, I'd eat it every day for the rest of my life, and that'd be my death meal, my like last meal. A food I hate, that was the other question.
Yeah.
Probably other certain kinds of fish.
Yeah,
like you're not getting me to eat some weird, I don't know, I'm really specific about I like tuna, salmon, lobster. If it gets too crazy on that menu, I'm not doing it.
So no puffer fish for you then.
No,
Yeah,
no,
no,
we're
oh
gonna
my
leave the
God.
restaurant. Yeah. I'm not doing that.
What's your favorite movie?
My cousin Vinny.
Oh my God. That is such a good movie.
Hands down. I was raised on that movie. That movie is so funny. I quote it at least 200 times a week. Every day.
I need to rewatch that movie.
Oh, so good. I can just say everything for you if you want to watch it.
Next time I see you. What's a hobby you have that most people might not know about?
Probably essays. I post them for fun on my personal URL just because I'm interested in other people's thoughts like that. But I don't advertise it.
Best concert you've ever been to?
Also, hands down, I was so impressed. Lainey Wilson, just last year. That was the greatest performance I have ever seen.
Really?
Ever. And that was the first time I've even heard her. I went with a friend who wanted to go and had never listened to her music and am now absolutely a fan ever since. Would go back over and over again, and I'd pay so much money for those tickets.
Nice.
I'm going to add her to my list.
It is unreal. Super talented.
Okay. All right. Last question. What's your ideal weekend?
Wake up fairly early, quiet morning on my deck with the flowers and the birds outside. Usually my dog comes, hangs out with me. Work a bit, then either go to the gym or go for a walk. If I'm going to the gym, I definitely want to ride my e-bike to the gym. Come home, eat breakfast. My husband's up. We hang out for a while or for the whole afternoon. Anything we can do outside, we'll do. Bike, walk together, walk Penny at the park, take the boat out. And then probably when we get home, make dinner at home, sit on the deck and eat dinner under our string lights, again around all the flowers. Any kind of easy at home with my family on the weekend and all the time outside in beautiful weather. Life doesn't get any more simple or beautiful than that. And any thought time I can have to myself to really think about projects and ideas and theories and all this stuff, like I love that. It's family, or I'm almost alone all the time, having a really good time in my head.
I love it. Oh, thank you so much for joining us. Learned so much. And I feel like everyone that's listening, definitely check out that free membership and really start working on your health and your wellness and really preventative care and really looking at it in that different way. I feel like it's so valuable and important. So thank you for just chatting with us about your vision. And I'm excited to see this grow and where it's going to go, because I feel like everyone in this country needs upper.
Thank you, Katie. That is really sweet. I really appreciate that. I think they do too. I really do. I think everybody just needs a natural first option, and it doesn't exclude Western options, right? They're just not the first in line. It's a simple reorder of options. Reorganize those and you could change everything.
Yeah. Thank you so much. And thank you everybody for listening. And we will see you on the next episode. Bye for now.
A big shout out and thank you to our sponsors for today's episode, Period Coaching School and Katie Bresek Wellness.
Thanks to you, our favorite bestie, for listening to the Period Besties Podcast, where no topic is TMI. And of course, share this episode with your besties.
Remember to leave us a 5-star review, nothing less than the best for us besties, and subscribe wherever you listen to podcasts.
You can follow us on Instagram at Stasha Washburn and at Katie Bresek, or email us at periodbestiespodcast@gmail.com.
Check out more about us at katiebresek.com and periodcoachingschool.com. And of course, check the show notes for free goodies and extras that support this episode.
We'll see you on the next episode.
Bye for now, besties.